Hey, Dr. Sampson Davis back with my health and survival plan. As you know, I always have these ER Chronicle stories, these interesting stories that I like to share with you. Bizarre stories, bizarre cases that I don't see too often. So get this, I'm working at this new hospital here in New Jersey. Great staff, exciting people. Patients love taking care of them. So this young guy comes in, 14 years old, screaming. He had sudden onset of testicle pain or pain in his balls. And so right away I rushed to his bedside. The pain started about an hour ago. He wasn't a sexually active young guy, thank goodness. And he was with his mother. He didn't want his mother to see his goods. So as I examined him, I noticed that one of his testicle on the right side was what we call high riding, was really elevated. For guys out there, you know how it is. When it's cold, your testicles usually rises up. So his testicle is high riding, and I was unable to move it. And so to me, it was like an hour onset. It was a case of what I call testicular torsion, in which the testicles sort of twist around and the blood supply is compromised. And this is an emergency. So right away, I had to get on the phone with the urology, get him over to ultrasound to see what things look like. And so I called a urologist, which is the doctor that specializes in this area. And everybody's busy. You know, it's tough to get the doctor to come into the emergency department because I don't have specialists just sitting here in my emergency department. So I go over to ultrasound with him, and we do an ultrasound. In ultrasound, you can see there's no blood flow to the testicle. And so now we have a window, get this, of about another 5 hours, 4 to 5 hours. If nothing is done within that time span, then he loses his testicle. Now that sounds like a long time, and this is saying 6 hours is the maximum amount where there's been some savage of the testicle in this case. But given that everyone's busy, 4 to 5 hours can go by really fast. So what I did is what we call an open book procedure. I took his right testicle and I twisted it counterclockwise. And by doing so, what happened is all of a sudden it was a clunk, it was a click, and I could feel the rush of blood to the testicle. His arterial flow to the testicle, or the blood flow to the testicle occurred, and the guy was relieved of pain. He started to smile. I smiled for him because I'm a man, and I know, you know, those are your precious jewels. And so we didn't want the young guy at an early age to lose his testicle and the ability to not be able to procreate later in life. So another successful case. You don't see testicular torsion too often, but if you have a young teenage son, it's something always to be concerned about. If they start to have sudden onset of pain, and if your mom and dad, they're not going to show you the testicle, but make sure you get them to the emergency department, because each hour that goes by, each minute that passes, you run a risk of losing a testicle and only having one testicle, and no guy wants to go around and be a uniball. So, bad joke, I know, but nonetheless, he did the right thing. We saved his testicle, and the procedure worked, and I was happy. He went to the operating room, and the testicle was stabilized so that it wouldn't reoccur. So, interesting case in ER Chronicles.